It's the EP Podcast. Evergreen Park.
I'm in Little Company of Mary. Actually, I'm in the, what is the name of this pavilion?
Mary Potter Pavilion.
Mary Potter Pavilion over at OSF Little Company of Mary here in Evergreen Park. Dr. Ginny Hendricks is sitting with me. And we're in one of the back offices right now because,
yes.
I don't want to go into one of the exam rooms, cause trouble, make a mess, contaminate something. I live that podcaster's lifestyle. But you are essentially, they called you a provider, same as a general practitioner, right? You're a doctor who sees patients about any kind of ailments they might be having.
Yep. So I'm a family medicine provider, which
Okay.
means I see people from birth to death.
Hopefully not that quick.
Hopefully not that quick, yes. And so I do not at this point in my life provide any obstetrical care. So if people become pregnant, then I send them to an obstetric doctor. But otherwise, I see newborns. I see newborns in the hospital when they're born.
So you start right at the beginning because my kids had a pediatrician. I had a pediatrician.
Yep.
I had a guy we went to until I was 18 years old, and I felt weird going to him because he kept meowing in my ear when he was checking it, because he was still doing the little kid thing.
Yeah.
But all he did was little kids,
Yeah.
and the doctors that my kids see only do little kids. But you start right at the beginning, the whole way.
The whole way. So, if my patients or if new patients have new babies and they say, hey, I'm going to have a baby, I'd like you to be the baby's doctor, then I'll see them here at the hospital if they're born here at Little Company. Otherwise, we'll see them for their first visit a few days after life here in the office. And the beautiful thing about family doctors is, one of your kids gets strep, you call in the next day, you're like, listen, remember we saw, Tommy the other day with strep, guess what I've got today?
Yeah.
And we're like, hey, we know you're our medical, you're on our medical team and everything. Let's go ahead and just treat you.
Right. You don't need to go back for it. That's always one of the more frustrating things for me is that, look, it's going through the whole house.
Yes.
I have the same symptoms.
Yes.
Do you really need me to come drive
But
out
if
there?
you're seeing a pediatrician,
Right.
then they're like, well, I'm sorry, you're not our patient, so we can't,
Right.
legally treat you.
That makes an awful lot of sense. So you're basically taking care of the whole family.
Yep.
And then you have the perk of being in the hospital. Like here at OSF, this pavilion is, I don't know, does it connect? Or do you have to go outside?
There is a walkway.
Okay, so there's a way for you to get in there. But you can just walk over if there's a patient of yours in the hospital with something and almost not only check on them, right? But if they're in the hospital, they may need a surgery, they may need something else, but you're still their primary. You can kind of step in and advocate. You can make sure it's going in the right direction.
Actually, more so. I actually admit my own patient. I am your attending provider when you're in the hospital. So if my patients who I've seen here in the office, they get admitted for any reason to the hospital, they are still under my care. And so I direct the entire team. If they need a cardiologist, I'll bring that cardiologist in. If they need a surgery, I'll bring that surgeon in. I take care of them. And then, I see them in the office, I see them in the hospital, I'll see them in the office to follow up. And I'm there the whole way. Occasionally I take a day off, somebody else fills
Right,
in.
yeah.
But otherwise I know exactly what's going on the entire time.
That's important because that's one of my biggest complaints about modern medicine is the idea that you are constantly going from one doctor to another doctor to another doctor to a specialist to a hospital to wherever you're going. You're constantly reminding them of everything that's going on.
Yep.
You might miss something. Nobody's sharing the same documents.
Mm-hmm.
And then you get this situation my mother had, not at Little Company. Okay, she got taken by ambulance to another nearby hospital here. And she ends up in there and she had just had a surgery. It was a planned surgery. She had a knee replaced. They put her on medicine. And there were so many doctors involved that nobody noticed that the painkiller medication was going to interact badly with the medicine she takes for other ailments. And she forgot who she was. Mm-hmm. And then they start thinking maybe she has a stroke.
Yep.
And then you can't get all the different doctors on the phone. And she was, for something that could have taken an hour and a half, she was in there for over 24 hours.
Yep. And
sitting in a hallway because the doctor who was in charge changed almost every couple of hours. So what you're describing is how I think it should be because that's incredibly frustrating.
Yeah. It's not the way that medicine is moving. Medicine is definitely moving to a hospitalist team that only cares for you in the hospital. And that's a lot about work-life balance for doctors and all that kind of stuff. But, my partner and I and a couple of the other doctors here at Little Company, we think that this is important. We think that, people should have continuity of care because it does reduce medical errors. And there's been huge improvements in the last few years about medical records. And now we do share medical records with all the local hospitals. And so the information should be there, but it's very difficult sometimes to access and to find. It's there, but somebody has to go digging through all of this.
Is that one of the harder things as a doctor with a new patient? like trying to make sure you understand the full history. Like I came from the belief years ago that as embarrassing as something may be, I'm going to say it. Like I will talk about anything with my doctor because I would go in and tell the mechanic what's wrong with the car.
Exactly.
So I'm going to tell him everything, but I also get the idea that not a lot of people do that.
And I tell people, I say, if you don't tell me, I don't know. I can't read your mind. And so, like, yes, we have to go through it all. And I think that, somebody has to take the time when you come in as a new patient and update our local records. But then you also have to go in and sort through all of the old stuff that's there and say, is this really a true problem, or is this something they were trying to rule out at some point? And it does take time, and that's one of the things that we struggle with is scheduling new patients because they're 40-minute slots. That patient comes in, they have to register at the front desk, they have to go through a medical history with my medical assistant, and then I come in and make sure all of that stuff is correct, and so those appointments are long appointments, and people don't always love the fact that they might have to wait a week or so for that appointment, but we do think that that's really important that we have things right, so that mistakes are not made.
You wrote a couple of notes. We're going to get to them in one quick second, but I do have a question I've always wanted to ask a doctor. And I really have. And I think everybody that's ever gone to a doctor's office wants to ask this question. Okay, why is it that some doctors, when I make an appointment to see them at 2, I see them at 2? And why is it sometimes when I make an appointment to see them at 2, I maybe get into a room at 2:45, and then they might finally saunter in at 3:30? And what kind of doctor are you?
Yeah.
And I'm not going to say today because there's a podcast screwing up your schedule probably right now.
No, this is my lunch break.
Okay, good.
You're in the slot.
But you get that, right? Some doctors are right on it. Like you have a 2:00 appointment, they're going to see you at 2:00. And some of them, it's like 2:00 is when they're like, oh, he's in the waiting room? Please enjoy this music for the next hour. Yeah.
Well, so my schedule, I essentially have somebody who's scheduled every 20 minutes.
Okay.
But not everybody has a 20-minute problem, and somebody may walk in and say, hey, doc, I got some shortness of breath, and it just started this morning, and then that kind of blows my schedule up because now I'm thinking, okay, is this person having a heart attack? Are they having a pulmonary embolism? And that may take 30 minutes. It may take 45 minutes to get through that patient and get everything situated. I may need to make phone calls to the pharmacy. I may need to call the hospital and get them an admission, all of that kind of stuff. And then, my next patient's already 20 minutes past their visit, and maybe they have a couple extra issues to follow up on.
God, these people with their problems.
But so, sometimes it can be cumulative. And so definitely, if you're like super, you have to have appointments like, go quickly. I think first thing in the morning is usually always, people usually start on time.
Because things haven't gotten screwed up yet.
Exactly. Okay. Like stuff has not started to snowball. And then like after our lunch, and so, but my lunch can be, some days it can be noon, some days it could be 3 p.m. if I'm working, one night until 7.
Right.
So, you can always ask, hey, what's the doctor's lunch break?
Yeah, I'd like to come right after the lunch when she's refreshed, she's fed, and she's not dealing with a bunch of garbage. Right, exactly, and happy. So I think you wrote down a couple things that you're seeing the most of or that you want to talk about. What do we got here?
Well, today? I think our main topic today that we want to talk about was diabetes.
Okay.
Because probably about 12% of Americans have diabetes.
This is what I threaten my kids with every time they want to eat more sweets.
Right.
I'm like, you're going to get diabetes. I'm a jerk.
Right? But it's so hard. Like when you have kids, like my kids are like, well, are we going for ice cream? Are we going for shaved ice? Are we going to Nicky's to have
Don't we get a
treat?
Yeah. I didn't get a treat every night. Yeah.
And so, probably over 50% of those people who do have true diabetes are undiagnosed, and that's a huge problem because there's a lot of health concerns that come from diabetes. We worry about eyes, we worry about kidneys, we worry about brains and nerves and all this other stuff.
And it's a blood test, right?
It's
all it is,
test.
right? 'Cause
yes.
I get... There's a printer going off next to us. I love that. I get a blood test every year, okay? Because there's so many different reasons to get one. I want to check all my cholesterol. I want to check my blood sugar. I want to check everything that's going on. I get everything I could possibly have checked out. I'm surprised a lot of people don't do that.
A lot of people don't do it. 80%
it just seems silly to me.
80% of people who have pre-diabetes have no clue about it.
You get an oil change every so many miles and every so many months. And you're telling me people aren't going, you know what, I'm going to walk in there.
No, people are like, hey, it's been a couple of years since I've seen a doctor.
Wow.
Yeah.
That's crazy.
Which makes, and so like it's an easy visit if you do it every year. You come in, they say, hey, did you get your mammogram? Did you get your pap smear? Did you get your colonoscopy? Get some labs.
I used to hate going in because they were going to weigh me.
Yeah.
And I was like, that was it. I'm going to go in, I'm going to get shamed because I used to be bigger. And I think that's one of the things that used to keep me away. But then I just did the trick of like, don't look at it. And they're not going to tell me.
Yeah.
And then they just want to check all the stuff. And then you just kind of move on. And then eventually I lost the weight. So, yeah.
And I mean, I have patients who are like, no, I don't want to be weighed. Perfect. Keep walking.
That's awesome.
You know, and
That's awesome.
we're, I mean, and
You're making a case for me to switch to you, Doc. You're like, you're gonna be here when I'm in the hospital.
Hopefully you're not gonna be in the hospital.
You're gonna listen to all my problems. If I see you after lunch, I'm not gonna have to wait very long. I don't even have to know what I weigh. This is great.
See?
Yeah.
But I mean, also, a lot of people are coming in talking about weight recently because there are a lot of new medications on the market and everything, and so people are interested in that. And I mean, we see it. You know.
What do you think? What do you think? Would you tell somebody to take that Ozempic stuff? Because they look like skeletons. They look like skeletons, these Hollywood people.
It's all how you take it.
They're all their faces are
for diabetes.
Okay.
If you're using it for weight loss, it comes under a brand name called Wegovy.
Yeah, but people are using it.
People are using it, yes. And so, I mean, some of it depends on how much you're using, what dose you're using, you know, how you're eating with all of it, because people do lose the muscle mass, and so you get the flat butt and all that kind of stuff.
Right, because everything goes away.
Everything goes away.
Yeah, that's a problem. Yeah.
But, I mean, you know, depending on where you're starting from, a lot of people are interested.
I guess that makes sense.
Yeah.
I don't want to be flat, though. I got to have a little curve. What else do we have here before we let you go?
They had also asked me to talk about like some testing for heart disease and other things, and so
it's very smart to do. I think we're gonna have a cardiologist on here in a future episode very soon. But I will tell you a little personal story here, and maybe you can kind of comment on. I would say it was about 2-3 years ago. I'm carrying a little bit more weight. I go in to see my doctor. I tell him everything. They're doing the blood test. He goes, your cholesterol's a little high, your blood pressure's a little high, and I think you need to lose a little bit of weight. You need to get a little bit more exercise. But I'd like you to go get this scan that looks at just your heart valves and sees if there's anything going on. And when it came back, he said you have a little bit of plaque in one of your arteries. You're not going to die. You're going to be fine. But like if you keep doing what you're doing, you will have a problem 10, 15 years from now. So lose weight and stop eating all the ultra-processed foods because that's the key. And I made a real change in my diet, what I was actually eating. It doesn't mean I won't have a hot dog every once in a while. But like I really changed the majority of the food that I was intaking, cut out fast food, all this other stuff like that, and suddenly saw a major change. And that's probably the kind of thing you're talking about because people hear what you're talking about. They go, well, I don't have any chest pains and I run, so I must be fine. And that's not the case.
No. And that's the beauty of coming in for a yearly, exam. We talk about what's going on. We check to make sure that we catch things early because a lot of times if you catch this stuff early, you can head it off. You know, dietary changes, exercise changes are hugely beneficial. And then you're not looking at a handful of pills every day, you know, but you have to know it's a problem to address the problem.
Exactly. Awesome. Well, if somebody wants you as their doctor or they want to come over here and see if they want a doctor at OSF, is it real simple?
Just call us.
Okay.
Yeah. So we have multiple locations. You know, there's locations in Burbank, there's Chicago locations. We're here in Evergreen Park. There's a Mount Greenwood location. They also have Oak Lawn, and then Palos Heights is their other location.
Okay.
And so
OSF is everywhere.
OSF is everywhere.
We're on the EP podcast, but OSF's all over the south side for sure. And there's doctors like you that are attached to the hospital, and it's incredible to me that something so simple is not used so often, right? That you are the kind of doctor that, you know, it's almost old school. You're like from the 1880s. Okay, old Doc Hendricks comes by with her bag and she births you. She takes care of your whole life. She helps out with the surgery and she stands there when they lower you into the ground. That's just
hopefully not too soon. We're not lowering anybody in the ground.
Dr. Ginny Hendricks, thank you so much.
It was a pleasure.
It's the EP Podcast. All things Evergreen Park. It's the EP Podcast. Evergreen Park.